And I think there's a lot of work that you've also done in California. So I just kind of wanted to share that with our profession, our community, all the work that you did in California before you went to the national arena.
Well, there were 3 great battles that I was involved in. The first one was AB 1943, and it had to do with the fact that the hours required to become an acupuncturist were very, very deficient. It was the acupuncturists themselves that said we should raise the standard so that we know that those who graduate really can do the job.
Yes.
It's a very compelling argument, and so I took up the cause.
Yes.
But at that time in Sacramento, they really were not that familiar with acupuncture.
That was still a while back.
It was 2001 when we started that. And it was an amazingly difficult battle. The Department of Consumer Affairs was very resistant.
Right.
And so we had to really push this thing through and had to mobilize so many people to come up for the hearings. I'll never forget our health hearing where 300 acupuncturists came up.
They're good at that.
Oh, for goodness sake, they came. That was one of the first big mobilizations ever, and they stayed there for 5 hours, staring at those assembly members in the face for all that time, and then finally testifying on that. Really and truly, Sacramento never saw anything like that. So I tell you, when we got that bill passed, it was a major, major victory.
It was.
The second battle had to do with the fact that in 2004 there was workers' compensation reform, but acupuncture was left out.
Yes.
So ridiculous, especially for workers' types of injuries.
It really put a lot of acupuncturists out of business. You know, like they had a great job and then boom, so that was huge to get that back in there.
So we did put together an official report about the benefits of acupuncture, presented it, and I'll never forget the testimony from patients, like a white woman who said she had to have surgery on her back, or she had a problem with her back. She did not want surgery. She did not want medication. She did not want to have this invasive kind of thing going on. And she tried acupuncture, and the condition was solved, and she was cured. And that was so compelling to me.
So many of those stories. So many compelling stories like that. And for us to have the legal right now to be in workers' comp, and we're primary care physicians in California in workers' comp, and that's huge. And we can't say that in all states have that recognition. And so it's bills like this that you had the cause for that gets us there, and that sets precedents for other states, because there's still 6 states that are not licensed. So these type of precedents really help us around the country to say, you know, this is what we did with workers' comp. So then you have a
So that was the second bill, and it was successful. We got it back in. The third was it had to do with the fact that herbs were taxed at that time, and yet you compare podiatrists, chiropractors, and other doctors, when they dispensed things to their patients, those items were not taxed.
Exactly.
So why were acupuncturists having to charge the sales tax?
Exactly.
So we presented it to the Board of Equalization. Actually, I was on the Board of Equalization at the time, and they were able to see the common sense of it, and they changed that regulation.
That's wonderful, and we have to thank all the Asian associations that led the way with you during that time. So we got to give a shout out to them as well, because that was very important for us. I mean, for us to be taxed on herbs when other MDs and healthcare alliance groups weren't being taxed, we felt like we're left out. So you heading that for the 3 great battles, as you call it, it really meant a lot for California. So thank you again for that. I think we kind of already went over how we came together, you know, from the state level and the national, and we also went over the responses that we had from all the community. So what kind of support and action assistance from the community do you want to have on EHB for the future? Do you have any ideas on that?
Well, I believe that there will be a comment period after the second bulletin comes out.
Okay.
So we will need to have participation again.
All right.
Yeah.
So that, like, would that be in the form of letter writing again? With the,
Probably.
Okay.
Yeah.
I can help with that. I think we can make that happen. And one of I've been president of AAAOM for the past 2 years, and my term is up on the 26th, actually.
Oh.
And in the 2 years, I think the highlight of all the work that I've done, a lot of it has been more internal, in phone conferences and, changing internally. But the highlight has been really working with you and on essential benefits. It was one of the biggest first phase victory, if we could say, because I know we have much more to come in the next few years, but working with you and just kind of getting to learn the ropes of how this works. And we did it grassroots. Our community would love to have like millions of dollars behind us, but since we didn't, we decided to do a grassroots campaign. And in that conference call that we did with you and Michael Termina, myself, and your staff, and Michael Jabor, we really felt like we wanted to show, Washington, D.C. that we're present, we're here, we want to do something. And the 25,000 letters only showed that even though we don't have the big bucks, we have hearts, and we can still, pull through. And so working with you and your staff have been truly a meaningful experience during my presidency. So I really thank you for that experience, and I look forward to working with you in the next few years on essential benefits and hopefully other causes as well.
Oh, yes.
Yes.
There'll probably be many, many more.
Yes.
But I have to say that this was a historic effort, and you did an amazing job. So, we will make progress with acupuncture. We will make it something that everybody can access all across this country.
I think one of the things that I would like to see also is getting acupuncture into military healthcare.
Oh,
TRICARE.
Yeah.
I know that's coming up somewhere down the road. So
yes, actually, I'm working on that too.
We're getting ourselves ready. But once we figure out what's going to go on with essential benefits, the next one I really feel strongly about is TRICARE.
Yeah.
So thank you so much for your time and always being generous with us.
Thank you.
Oh, thank you.